Welcome everybody to 2014 IEEE Embedded Systems Conference. It is a wonderful time to get together this time of the year and take stock of how technologies have worked to make human life even better than the last time we met. And the challenge here is the desire that I have is after we go from here, we talk about these futuristic things and we start working on making it better. Implementing it and cutting new frontiers so that everything that I talk about would soon be obsolete. And next year, when we meet again, we'll be talking about something totally different. And we'll say, oh, this is still news. That would be a wonderful thing to do. So I would like to talk to you now about top 10 health predictions that I have picked up. That is the picture of my book that I will be book signing after the conference. And also I want to put a disclaimer that all the thoughts and the views that I express are my own. A few words about myself. I am currently a Chief Technologist for Innovation of HLS at Hewlett Packard. I'm also a HP Distinguished Technologist. I've been grateful to work with the world's greatest companies, HP as well as I was a platform strategist at Intel, and I was before that a CTO of emerging technologies at TIPCO, and as well as director of development at Symantec. I am the author of Transitioning Embedded Systems to Intelligent Environments, which was an Amazon bestseller for a long time. I also invented many cutting-edge technologies, which include Intel's reduced interoperability technologies, CA technologies, event correlation engine, as well as dozens of cutting-edge technologies at HP. So first thing that I find very exciting is medical implants. We all know one of the bottlenecks in development of medical implants, in the use of medical implants to make human life better, was the fact that we needed to have batteries inside them. We needed some way to make them function. And when we had batteries, they came with a battery life. You can't charge things that are inside the body easily. So again, you would have to have surgery after a few years to keep changing the batteries in them. Because of all these problems, medical implants did not reach the potential that it was possible to do. And then we started having things that are making it a big difference. Piezoelectronic technology is one example. What you see here is an implant, and it's an implant with flexible piezoelectric film, and it is developed by University of Illinois and University of Arizona. This is an example of how energy can be harvested from where does it get it? From the beating of the heart. The heart is always beating. You can count on it. Till you're living, your heart is beating. And taking that energy, one can actually use the piezoelectric technology and turn that into power for the device. And those devices may be pacemakers or they may be other implants within the body. So a cardiac pacemaker is one example, and many other examples. Imagine having all those implants without needing any batteries for them. So that is, I think, one trend that I find very exciting. So let's look at another. Regenerative technologies are another thing. Stem cells have been around for a while. We have been experimenting with them. But the regenerative technologies that have been made possible now by the pervasiveness and the increased ability of the computing devices and the breakthroughs that we have made in the implementation, the software implementations of how to analyze stem cells. So that have grown remarkably. And so what has happened as a result of that? What you see is an example here. The example here is how a gland called thymus, a thymus gland, it was regenerated in animals at Scotland University at Edinburgh. So what you see in the picture is a gland. It is called a thymus gland. It is inside your body. and it has a function. But we know that as we grow old, our organs will not work as well as they did when we were born and younger. Not only that, some people are simply not blessed with perfectly working organs. So this is good news to them. What this does is, let's look a little deeper into what has been done. How are we able to build a thymus gland out of regeneration technology? We know that something is produced by all these glands. The protein that is produced by this gland is called FOXN1. So what is the importance of FOXN1? When there is no FOXN1, there is absence, then the human being has immunodeficiency. So what is this immunodeficiency? It causes a problem, and this is the FOXN1 that is secreted by the thymus gland. How do we fix it? We take a large quantity of this protein. We add that to the human stem cells, and by adding to those stem cells, the thymus gland starts to function. And because of that, immunity of the body is improved. So this is an example of how regenerative technology, leveraging the stem cells that we know about for a few years, is going to really help usher in the new way of living. Just because we are old doesn't mean our organs have to fail on us. The third thing that I want to talk about is cancer related. How cancer will be detected in blood. What does that mean? So far we do detect cancer, and we detect it through X-rays, MRI, various imaging techniques, which we don't do every day. We just do them once in a while, maybe annual exam, or when some problem presents itself. The problem with that approach is, it is too late. By the time you find out there is cancer in the body, it has already progressed to an extent that it's not good enough for us. So there has been a lot of focus on how can we improve it. So this new thing that is coming up, a new trend that I see, and I want to list it as my top 10, is the fact that blood test can tell us about cancer. And these blood cells, white blood cells, have been used to detect or even assess the risk of cancer. And this was done by University of Bradford. And when X-rays and scans, even before they start showing, the blood sample is all easy to take and is always taken in your hospital visits. So in the blood sample, if you expose the blood sample to ultraviolet light, then some people who have more sensitivity to UV light, the fact that their white blood cells are sensitive to ultraviolet light means that they are either in early stages of cancer or they will have cancer. So you see how powerful that thing is. We can look at the blood and say, you're going to have cancer. And just that knowledge before time, in such an easy manner, will help save lives. So this is one of the very exciting technologies that is helping humans' life get better. The fourth one is again detection of another disease that impacts a lot of Americans and people worldwide, and that is Alzheimer's. So when you look at Alzheimer's today, by the time it impacts the brain, that's when you find that people are dysfunctional in some way. Then you say, oh, what is wrong with him? Why is he forgetting things? And then you go and take a brain scan and find out, oh, he has Alzheimer's. Again, that is too late. How can we fix that? So this new invention that is done, these tests are done by neurovision. What do? They are non-invasive, first of all, and they do retinal imaging. They look at your eye, they look at the retina, and then they can predict. They can say that one is in early stages of Alzheimer's. And so what is it? How is it? Let's look deeper into it. How is it that they are able to detect Alzheimer's in the eyes even before it reaches the brain? That's because they look for a plaque which is called amyloid beta plaque. And what this plaque does is, it shows up in the eyes. And then at that time you don't have any symptoms. And slowly, when it goes into greater stages and more of it is accumulated, it goes into the brain. And once it reaches the brain, it triggers Alzheimer's. So you see that the fact that we can now, we will be soon able to detect Alzheimer in the eyes is going to save a lot of lives and prevent a lot of medical complications before they can even start. I want to talk about something which is very similar to the technologies that we have talked about, but it's slightly different. The difference is, it is nanoscale because we are talking small size. It is nanomedicine. And what does it mean that medicine has nanoparticles in it? What does the technology do? It delivers medicine. You would think, oh, so what's a big thing? I've been taking medicines. We swallow some pill, or I give myself injection. What is new about this? Well, what's new about this is the fact that it goes directly to the cell and delivers the medicine to the cell which is impacted. So imagine today if you have cancer, if you take some medicines, they go through your stomach or through your, invasively they are given. They will cover all of the healthy cells also. And healthy cells will be exposed and you will have a lot of side effects. And then some of it may or may not reach the target. So this kind of rough approach, this kind of very generic approach that we have to medicine today will be greatly improved by nanomedicine. And how will that happen? So this is an example where they use nanomedicine based technology to deliver drug and for cancer. So cancer cells were given medicine, and this was developed by Harvard Medical School as well as Dana-Farber Cancer Institute. And it can precisely deliver drug directly to the cell, and that's the beauty of it. And it can also deliver a concentrated amount of, because it goes nowhere else but there, you can give it in a concentrated form and not worry about any side effect to the rest of the body. And you can catch tumor much faster and stop it in its track. So that's why I am very excited about nanomedicine that will deliver drugs. One more area that I want to talk about today, and I don't think any top 10 list will be complete unless I talk about how we can mimic human beings in the lab, because that is one of the frontiers that will get rid of so many problems that human beings today face. So what we see here is that organ on chips will mimic humans. So we can have organs like human beings, but they will be on a chip. So what you see here is developed by this institute at Harvard, and it is a kidney on a chip. So what does this kidney on a chip do? We know that the role of a kidney in a human being is to be a filter. It's basically a porous membrane. The liquids pass through it, body's fluids pass through it, and they are filtered if it works correctly. So this is also a porous membrane. What is there in this device is a porous membrane that emulates kidney, and on that we grow cells from the kidney itself. And then, because a healthy human kidney cells are put in there and they are grown inside the device which has a porous membrane, we can mimic the filtering action of the kidney. And the second thing is, how do we test it with different pressure of the fluid? We can pass fluids through it just the same way as our kidney is exposed to various fluids in our body. So by mimicking a human organ, a human kidney, we can actually do the drug testing in the lab. And we don't have to do it on animals. How many times have we heard, oh, we tested this on mice. Oh, by the way, human beings, it didn't work for human beings because mice are not humans. Or they will say, oh, this worked on other people. 9 out of 10 people it works, but it doesn't work on you. Because every human being is different, and my body may be very different than anybody else's. So rather than becoming a guinea pig and being subjected to drugs that may cause havoc with your body or may not be as effective, you can have organs on chip, like kidney on chip, that can emulate the body's function outside. And once the testing is done, you know exactly what the medical strategy needs to be. So number 7, top 10 predictions for health technology. I want to talk something on the similar line, but still different. This one is a gut on a chip that emulates intestines. So what you see here is a gut on a chip by Harvard. And the device is nothing but a silicon polymer. And it's a chamber, it's a silicon polymer chamber, and inside that it is lined with intestinal epithelial cells. So human intestine is lined by epithelial cell, and you take the silicon polymer chamber and then you line that with epithelial cell. So it's simulating you in the lab, and it mimics the passing of the food through the human intestines. And doing that, there are many diseases, like Crohn's disease is one. We don't understand that well enough because we can't do experimentation with human beings. This technology, gut on the chip, will enable us to study more research, more problems, diseases like Crohn's, and to find out what is the best approach to fixing them for human beings. The next one is blood. We talked about blood. We're always testing blood. In some cases, it is okay. In some diseases, it is okay to get it tested once in a while. If you have thyroid, underactive thyroid, overactive thyroid, it's okay to get it tested every 3 months and then adjust the dosage. Or there may be other problems where it is okay to get it tested every once in a while. But diabetes is not that kind of a disease. It has to be maintained in real time. And what does that mean? That you have to have continuously going into the blood. You have to be continuously measuring the levels of glucose in the blood, and therefore decide how much insulin to give yourself. So we know there is a need to continuously monitor blood sugar. That's an example. How do you do it? How do you monitor it non-invasively? That is the next big thing that I predict will be one of the top 10 trends that will take us. So one example that I have here is a device from Echo Therapeutic Symphony. And as you can see, it's something that goes like a band-aid on your body. And it is non-invasive, it's needle-free. More important, and of course it's wireless, more important, it continuously tests your glucose. Not once in an hour, and you don't have to prick your finger for that. And what are the components of this device? It contains a skin permeation device. It contains a transdermal sensor as well as a wireless transceiver. And how does that work? It wirelessly, it's always reading the glucose level, and it sends every minute to a remote location where one can identify, were you hypoglycemic for a long time, or were you hyperglycemic for a long time? So that kind of alerts can be raised if a person with diabetes is going through any kind of abnormality. Can you imagine that? How beautiful, how easy it would make the life of people who have diabetes. So this is, coming close to the list. I will tell you, it was very hard for me to pick just 10 of them. How can you do when everywhere you turn, medical technologies are being developed that are helping our lives? For me to pick 10 was a challenge. But these are the ones that will usher us very quickly into the new generation of human health. And now I want to talk about number 9 is a brain chip. What does this brain chip do? It allows us to control the environment, interact with it. And what does it mean? So I am talking to you, I can move my hands around, I can go to the keyboard, and I can shake my head and talk to you, engage with you. However, not everybody is so blessed. Some of us need prosthetics. Some of us are handicapped in different ways. So, but their brains may be fine. Their bodies, they lost a limb or something like that. So, this is a solution for them. It is an implantable robotic arm which is controlled by thought. And this was at the Chalmers researchers have built. And how does it work? So when I have to move my arm, how does it happen? It's still my brain that decides that I want to move my arm. The brain sends a signal. That signal is received by the nerves and transmitted, and the physically the arm then moves in response to my brain signal. This is what normal people do. This is what people that don't have an arm or a limb do. They do the same thing, except that they don't have anything at the end which gets moved. So this actually solves the problem very well. It consists of, there is a prosthesis, right, for amputee patient, and they have, it is like a robotic arm that they have. Brain signals from the human being are captured by the brain chip, then they are transmitted, they are transferred through the nerves, and then the nerve endings go to the wooden stump, the arm stump, whether it is whatever kind of material, there may be a variety of materials by which it is made. But that is how the brain signal naturally controls the movement of the arm. And that is one of the biggest breakthroughs that we can do, because that's the closest you can get. Because today's prosthetics, we move them by physically moving them. We don't use our brain to move them like normal people do. And this will break that barrier and make the life of those amputees much better. So no list will be complete unless I talk about how, we talk about all the great things labs or electronics and technologies can do, but no list will be complete unless I talk about how human tissues can be printed by 3D print technologies. This is very exciting. And what you see here is actually a machine. It's an Organovo NovaGen bioprinting platform. And what does it do? It bioprints liver tissue. And how does it do that? So today we know that organs are always on demand, but we don't, people need organs, but we don't have enough donors. So there's a long line. If you need an organ to be replaced, there's a long line. Imagine having the ability to just get tissue on demand. Oh, this person needs a liver. We need to get a liver tissue inside his body. So that's what this machine does. Traditionally, liver tissue only grows inside your body. That is been a bottleneck because there are lots of reasons. One, it doesn't grow. You don't know what's in it grows. You don't know how to make it grow. Even if you transplant it, you don't know if your body will reject it or what will happen. So if you're able to print using the biomaterials, the biomaterial in this case is the material of the liver. So by using the liver material itself, one can bioprint the liver tissue. So it is fabricated outside the body and it can be transferred to you. So we don't need a donor. We can use body's own mechanism to print it out and just be on the go. Can you imagine a life where we could get anybody, any of us who needs organs, we can get it on demand. And we don't have to be in line or dying before a donor actually shows up with the compatible set of organs. So these are the 10 ways where I think we will take ourselves, human beings will reach a new frontier. Why did I pick health and life sciences? Of course, obviously I am HP's Chief Technologist for Innovation for HLS, which is Health and Life Sciences. Other than that, I think technology can be used in various ways, but how it impacts humans is, for me, the best way that we can transform the world, the fastest way to transform the world. And that is why I wanted to share and these exciting areas with you. And I thank you so much for being part of this excellent transformation that we all are undergoing. As I said, the challenges go back, invent some more, make these obsolete already. Thank you.